have is a dental emergency kit. You need to know CPR, and I think most of us are trained in CPR. And have you heard the new CPR? That's amazing. And they're saving 30% more lives. And that's where when they find somebody that just stopped breathing or the heart stopped, you sit there and you do 200 compressions within 2 minutes, just boom, 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 before you ever do a breath. Because they say the blood has all this stored oxygen in it. And the first thing people do, they try to blow air into the lungs, and they're not even utilizing the oxygen that's in the blood present already. And they're finding out if they just start pumping real fast, just fast, you know, and it starts pumping that blood through the heart. And then they start doing the air.
They aren't even doing the breathing anymore. They just skip it. If you're just taking it at the Red Cross and you're not a health professional, they don't even do the breathing.
Really? They're just doing the pumping. Really? Oh, I didn't know that.
In California, only healthcare providers
Can do the breathing.
Well, that's all they're, and they're the ones they do teaching that, and then the AED.
Wow. But I saw that thing, especially on TV, and it's amazing how many more lives they're saving. And then they're cooling the body way down. They're putting the body into hypothermia, and that preserves the brain, and then they slowly bring them out. And they don't even know why that works, but for some reason that works. And they're saving a lot of lives by doing that now. And then one emergency, I always take a little dental emergency kit with me. And this is a Plano. It's probably from Plano, Texas, right? Yeah, just a tackle box thing I got at Walmart. And it's got different little things, items in it. And I take that along. And the number one emergency that you'll probably find on a mission trip is controlling bleeding. Every once in a while you'll get a bleeder. And we were in Colima one time, and it was not with you, but with another doctor. Took out a wisdom tooth, came out real easy. But man, it just started bleeding and bleeding and bleeding. And I had a hard time getting it stopped. And this other dentist was with me, and he walked by, and I showed him, he was an Iranian, and I showed him the bleeding. He I thought he was going to pass out. He doesn't do extractions in his office. He said, oh man, he says, good luck. So I had this stuff along. I keep an emergency, but it's Acticel. And I've got samples here. I called the company, and the guy just sent me a whole bunch of samples, so you guys can take them. It's just gel foam. It's just hemostatic gauze. And what I do is I just peel it open. And you don't use the whole thing. I cut it in half. If it's like a molar, if it's a bicuspid, I cut it in a fourth or a third. Just kind of eyeball it. And then I just wad it all up and with cotton pliers, and I just shove it down in there. And then I suture over the top and hold it and have them bite. What? It's nothing. I don't know what's on it, to tell you the truth. It performs a mechanical clot. And when we were in Haiti, I had a young man come in, took a first molar out, all 4 quadrants, 1, 2, 3, 4. He came back the next morning, and he was bleeding. It was the upper right quadrant, the upper right first molar, and he was still bleeding. So I got him kind of cleaned up and looked, and it was just coming out. It was just like a strong ooze. It wasn't like flowing, it was just oozing real strong. So I wadded that up, stuck it in there, sutured it, and stopped. It stopped almost immediately. And another thing I take with me is we always take, I like Septicaine, Articaine, because it seems to really get people numb, and you use less of it. And there's a big controversy on whether to use it on mandibular blocks or not, but I've talked to the people that know, and they said they've never had a problem with it, and so I use it all the time on mandibular blocks. I've never had a problem with it. And then I also take some xylocaine. I take the 1 to 50, and that helps with bleeding control. If you start getting a bleeder, like immediately I'll inject that around the area before I use this too. But it's just like a combination of everything. But you want to stop bleeding. We had an incident in Brazil on a river tribe, and I pulled a guy's lower tooth, and I guess he was a hemophiliac. Just a little loose lower front tooth, and it just kept bleeding and bleeding and bleeding. Didn't have any of this stuff. So I just sutured it up. It was a solid wall of suture across there, and it finally stopped. And but the crowd was pressing in around us, and that was scary because they were really getting, people were getting all kind of, they knew I was nervous, and you could just feel the tension. When it stopped, then everything was all right, but you just don't know what could happen. So you have to be really careful. So I always look at bleeding as like a #1 type emergency, because that's the most life-threatening thing that could happen on a mission trip. And then another thing is anaphylactic shock. And most people in third world countries, they already have died from the bee sting or whatever was going to kill them. But you never know. Usually it may happen to somebody in your own group, or in your own team, that gets a bee sting or something. Because in third world countries, they don't have that follow-up like we do in our country, and so lives are saved, and we know what's going on, and people are able to prevent it. You can take an EpiPen along with you. That's $62 for an EpiPen. Or you can take a little vial of epinephrine with a syringe, and these vials are like $1 or $1.50. So I take a couple of, and I wrap these up because I noticed the last time I went on a trip, one of them was broken. So I don't know if TSA checked it out or it just broke inside the case. So I keep them wrapped in bubble wrap. And then I take some Benadryl along, and you can follow it with Benadryl. I take both that and also tablets, Benadryl tablets. Sometimes people will pass out on you, so I have a little ammonia inhalant in here. You take out, I've got 3 or 4 of them. Take some ammonia inhalant. Somebody in your team, usually in your team, or a patient has heart problems, first thing you want them to do is chew an aspirin up. So I always take aspirin along. And right next to that, I've got I keep this up to date, these nitroglycerin pills, because they do go bad quick. So I keep them up to date. I used to use the spray, and the spray lasts a lot longer, but it's really expensive. You can get these little tablets pretty reasonable, and just keep updating it. And I also have some ephedrine sulfate, just to take along. And then I got a little book here from Loma Linda, Office Emergencies, and it's out of print. I wish it was still in print. I just noticed that. And anyway, it just goes through all the different problems you can have in office emergencies. And so if you have a little book like that in your office, you know, just take it along with you. Because, you know, when you're in a crisis situation, sometimes you just can't think straight. But if you know you got a little book, you can flip through it. Just something, you know, something to reassure you that you did the right thing, basically. And a lot of times you do the right thing at first, but then there's follow-up, and that little book tells you what to do as time goes on. And sometimes you'll run across people that are diabetics. I had no idea there's a lot of diabetic people out there in third world countries. I had no idea till we started taking the youth. The last 7 years, Nita and I have been taking high school kids on mission trips, and we train them ahead of time. One thing we train them is glucose monitoring. They do the glucose monitoring, they do the blood pressures, they do the eyeglasses, and then they do puppets and different skits. But when they do the glucose monitoring, we've had people that they're like 400 or 500 blood sugar. I mean, they shouldn't even be walking around. And so we will actually, in Mexico, you can buy insulin right in the drugstore. So we'll give them just a little tiny, but we have a pastor that goes with us who's diabetic. So he understands all that, and he'll give them a little bit of insulin. And have them set right there. A couple hours, they're feeling great. So you tell the family that this person's diabetic, he responds to insulin, he needs to see a doctor. A lot of times they'll never take the family member to a doctor because they don't do checkups. But once they find out something is wrong with them, then they'll bend over backwards to help them out. So I take, if somebody does have a problem with taking too much insulin, I take Gatorade along, and that's for different, sometimes people get too hot or something, you can mix it up and have them drink it for electrolytes. And then I take Well, I got this Afrin along, and I don't know why I got that along. Other than a nosebleed. Tell you, I saw a paramedic one time. This guy had a nosebleed, and he takes this Afrin, he squirts on a cotton ball and sticks up the guy's nose and holds it, and it stopped bleeding. And he said it really controls nose bleeding. So I just, that's handy to have along. I've never tried it on a tooth socket or anything. But what? Oh yeah, we did it on a lip. Yeah, I had a cut lip. We did it on a lip and it stopped it. So I just have it along, just as an extra precaution, just to something to control bleeding. And I have a pair of these along. We're always putting things in people's mouths, so I just have these along with my emergency kit. Just a little McGill forceps, so pulling things out if something gets stuck in somebody's throat. And that's it. And then for your hand washing, nothing beats soap and water. You need to use soap and water. But they have OSHA-approved towelettes out there now, and that Perel works, and the hand sanitizer and things like that. So any questions on any of the equipment?
You want to talk about needle sticks?
What?
You want to talk about needle sticks?
Yeah.
What you do with them?
What I do with a needle stick? Pray.
30 gauge needles, I know.
Well, 30 gauge needle, that's a number thing, but then one thing, I just make it
On
bleed.
yourself is one thing, but on maybe a volunteer that's
Oh.
coming with you,
You just make it bleed a lot, and then just wash it down real good with the...
Use some formocreosol.
That's exactly what we use. That's exactly what we use. We use formocreosol. We make it bleed real good and put formocreosol on it. I don't know if we've never had anybody have any problem, but I'm sure, But we're just really, you just got to be really careful. Like when we train these high school kids, we do 12 weeks before we ever go on the trip. For two reasons. Number one, before they can learn all this stuff. Number two, for them to bond together. We'll have kids, we have a lot of Hispanic kids in our area. All the Hispanic kids will be sitting on this side of the room. All the white kids are on this side of the room. After the mission trip, they're all so mingled together, it's unbelievable. And it's amazing how God has worked in these lives. And I'm just going to quickly go through the reason we go is evangelism. And yes.
About stuff. Drinking water.
Oh, you know what? You guys take these with you? You find them in Walmart. It's by Sawyer. And even in Haiti, we just drink the tap water. Just put it in here and when it pops open, it's got a little straw, and just drink through it. Everything goes through this filter. It's like reverse osmosis filtering type thing. It really works well. It's made by Sawyer, and that's what we've been using a lot. What? Yes, you can replace the filter in it. Yeah. I have a gut feeling it's when you can't get any. It gets so plugged up you can't get suction through it anymore, I think.
I saw on TV, and I was wondering if maybe you had picked up on it. During the Haiti crisis, Ashley Judd was very involved in this with Pure, P-U-R, the water company.
Yeah.
And they have a material out now that's in a little packet like a sugar packet. And they demonstrated it. They had a gallon. It purifies a gallon of water. And they said you can take sludge from the gutter. You can take sewage water. And they poured it into this. And what it does is coagulates it. Yeah, and it all drops to the bottom. And then you pour it out through a T-shirt material. And she drank it.
Wow.
Yeah, poured it out and drank it. And I was very impressed with it. It's just in a little packet of sugar.
I had some guy, here's some more samples. It's socket. After you do an extraction, like a hard one, you give the patient this little syringe, and they can squirt it down in the hole. It's like dry socket paste, basically. It's like home treatment. And we gave most of the extractions in Haiti one of these, and it seemed to work well. And these are just samples. This guy gave them to me out of Texas. So guys are welcome to try that. And then Septicane has a new dry socket paste out, which I really like. I've tried different types of paste. If it takes you more than 5 minutes to get a tooth out, I'd put some of this in it. It seems like the teeth that take the longest to get out are the ones you're going to have the most post-op pain with and most problems with. So and what's neat about it is it's well, you can come up and look at it afterwards, but it's fibrous. Almost looks like horsehair or something. And you can just kind of pull out a little ball of these fibers and just poke it down in there, and these fibers slowly dissolve, so it stays in place. It's really neat, and it's made by Septicane, and I've been using it. It seems to be working really well.
Just to comment on that stuff, I've been using it for years in my practice, and that is fantastic. I mean, you pack that stuff in there, and they don't come back. And then you don't have to worry about taking the stuff out or anything. And
Right.
It's great stuff.
How come you didn't tell us before? I just found out about it. No, it didn't.
Pricey, but it
No.
really saves a lot of time and hassle.
You know what? Pricey don't matter when you're on a mission trip and you think, man, I'd pay $200 just to get out of this mess, you know. You know, you get that feeling like price is not an issue when somebody's in trouble. Yeah, exactly. Yeah, it relieves pain. It really works well, and I've been using Septicane for a while, and I was talking to the lady. She said, hey, you want to try that? She gave that to me. She just gave me the sample there. And I said, sure. So,
That looks like snuff.
yeah, it does. It does look like snuff. It's kind of but it works well. So I just wanted to pass that. I'm glad the other guys are using it. It really works well.